Welcome to today's video where I'm going to talk a little bit about why lupus is often misdiagnosed or just missed altogether. A little bit of basics to start off with. What are we talking about when I'm referring to lupus? Well, specifically, I'm looking at lupus when it is widespread throughout the body. We call that systemic lupus erythematosus or SLE, but it is commonly just called lupus. This is a very complicated autoimmune disease. It is an attack by your defensive system, your body's immune system, against components of your body. In particular, it's characterized by the formation of antibodies against a component of our cells called the nucleus. So anti-nuclear antibodies, or ANA antibody, is a key finding in lupus. And the nuclei contain all of our genetic material, and they're present in most of the cells of our body. You may also get antibodies against our own DNA, double-stranded DNA antibodies. If you imagine about all the different places you may see DNA across our bodies, you can see just how broad the number of complaints and variety of presentations could be in systemic lupus. So it does come with some more common presentations, so joint pains, rashes, especially rashes that are sensitive to sunlight, persistent mouth ulcers, hair loss that leads to bald patches or scarring hair loss, which we call scarring alopecia, and fatigue. But you could see that many of these symptoms themselves are not particularly specific. Joint pains, fatigue, dryness in the mouth and eyes, these are kinds of features that are pretty commonplace. And it's not common that lupus is going to be the first thought in mind. Some of the features of lupus can be much more serious and at the same time quieter. So lupus could be silently causing kidney injury and you wouldn't know about it because it may not cause pain. Lupus nephritis may be picked up for another reason when you have a blood test and your kidney function is noted to have gone down. So some of the features of lupus are silent. The common things that might be looked into first are things like a persistent fatigue syndrome, like chronic fatigue, widespread pain conditions like fibromyalgia, conditions that cause fatigue from other metabolic disturbances like hypothyroidism, and also conditions that can cause fatigue that are not from, say, what we call an organic illness. It might be that there's some insomnia, mood disturbances from things like depression and anxiety. So another factor is how do we test for lupus? And there isn't really a defined single lupus test. So you can't just go to the doctor, have a test done, and be found to be lupus positive. The anti-nuclear antibody is very helpful. And if you have a negative anti-nuclear antibody, it does significantly reduce the risk that you will have lupus by really quite a substantial margin. There are some fairly unique cases where you may still make a diagnosis of lupus in someone who has a negative anti-nuclear antibody, but they are, I would say, the exception. But a positive anti-nuclear antibody doesn't confirm lupus, and you can have a range of levels of anti-nuclear antibody. The other antibodies that we'd look for, like extractable nuclear antibodies such as the Smith antibody, or as we talked about, double-stranded DNA antibody, they're a bit more specialized, and a family medicine doctor or general practitioner may not want to organize those. So unless someone thought to do the anti-nuclear antibody and then it came back positive, you may not have had some of these more specific investigations done. So what's the lesson here? I think if you're having persistent symptoms that have been investigated for the more common things, and it is right to check you for more common things like thyroid disease, make sure you're not anemic. But if you're getting persistent joint pains, persistent mouth ulcers, symptoms like Raynaud's, where the fingers go a cool and white color in cold weather, hair loss giving rise to alopecia, joint pains, especially those that are stiff or painful or swollen first thing in the morning, if those are the kinds of symptoms that you're experiencing, and you've already been through a process of looking for common and reversible causes, then checking for an anti-nuclear antibody, I think, is probably a good routine step. This might be slightly controversial because rheumatologists often get asked to interpret anti-nuclear antibodies that were done without a clear rationale. But I think at least if you had a positive anti-nuclear antibody and unexplained symptoms like those that I've listed, that might buy you a rheumatology consultation who can at least interpret the positive anti-nuclear antibody in the context of your other symptoms and give you a specialist opinion as to whether lupus is likely to be the cause in your case, or whether indeed this is not looking like lupus after all. I hope you found this short discussion on lupus and why it's difficult to diagnose helpful. I'd love to hear any thoughts you have in the comments or any questions you would like. And as always, if you do find these videos helpful, a like, comment, share, or subscribe can really help me to get better visibility so more people can get access to this content. Thank you.